My name is Alison. I'm 42. My husband Ron and I have been married for 20 years this year. I am a caregiver to him for the last 3 years with gastric cancer.
Hi, my name is Ron. I was diagnosed with stomach cancer in November of 2020. When I was first diagnosed, my gastroenterologist is the one that diagnosed me with the ulcer that turned out to be stomach cancer. And then I immediately went to my oncologist, which I now have an oncologist. She gave us her opinions and highly recommended that we do get several other opinions. The most important number one question you should ask would probably be, what is going to be your treatment therapy? Like, what's the outline going to be? We are, at least in my situation, we were not told exactly what we were going to be doing. We were given options. So we had to make decisions, and the decision-making process was the most challenging one. Early on, you're given a couple options, and having options was not really what I was expecting. I was expecting a doctor to say, okay, Ron, you're sick, this is what you need to do. But I was given several courses or several treatment options to explore. So, I contacted some family, friends, we had second opinions with different doctors, and then we finally selected a course of treatment that I thought was most reasonable.
But also be educated on what other options that you might have. Our oncologist refers to it as always having something in your back pocket. You don't want to just rely on one thing, and when you get that pathology report, it's going to have a lot of information that you might not be able to understand, and that information might be the key to a targeted therapy. Sometimes it's very easy to just open up a book and say, all right, that's standard of care, but in most cancer cases, there are other options to have, and we depend on our oncologist to educate us on that. So be sure to ask those questions.